So New South Wales recorded 89 locally acquired cases of COVID in the 24 hours to 8 p.m. last night. The majority are close contacts and household contacts, but there are some unlinked cases. There were 49,055 tests were reported to 8 p.m. last night. Sadly, a man in his 70s from Sydney's eastern suburbs died yesterday, and he was a confirmed case of COVID-19, and I extend my sympathies to that gentleman's family. Of today's 89 cases, as the Premier has indicated, we had 55 in isolation throughout their infectious period, 6 cases were in isolation for part of their infectious period, and 21 cases were infectious in community, and we were confirming the isolation status for another 14. This is still too many people in the community that are infectious. It is essential that we stay at home and only leave home for the most essential of reasons. And can I just also reiterate, do not visit other family members in other households. The unit we want to keep together is the household. We do not want you inadvertently spreading it to other family members by visiting them. Just as an example, which I think highlights how effectively this virus spreads through households. Of today's almost 60 people, just some examples that we've got one household of 7 people, one household of 5 people, and 5 households of 3 people. So by the time we get to the households, this virus is effectively spread through that household at a very rapid rate. And inevitably, over subsequent days, we'll see those case numbers increase as remaining members of households potentially infected because they've been exposed to their household members. So it does highlight the importance of keeping a household unit together and not moving outside the house and not interacting with others. I would like to just highlight some areas of concern. So whilst the Premier has clearly indicated our focus is on Fairfield local government area, it is critical that we do not become complacent across the rest of Greater Sydney. The risk exists everywhere, and every time someone leaves your house, you have to assume that the person that you may be encountering at the shopping centre has got COVID. So act accordingly. Ensure you are wearing your mask. Shop purposefully. Minimise your time. Put your mask on before you're going into the premises. Ensure you keep your distance and do not interact with others socially in any shopping centres that you're going to. In terms of the areas of concern, and this just highlights that while we've indicated Fairfield, everyone else also needs to remain vigilant. We're concerned about Roselands, Rosebery, Canterbury, Belmore, Sutherland Shire, the St George area, and West Hoxton and Glenfield-Green Valley, in addition to Fairfield local government area. So they're the areas we want increased testing. But as I said, those suburbs change day by day, so it is important this reflects past risk. Every time anyone leaves their home, they should assume that anyone they're interacting with has COVID and act accordingly to protect themselves and their loved ones. Thank you.